I do get that question a lot. You know, why do this here? There's a lot of problems in South Carolina, and why would we, you know, dedicate resources perhaps to doing this globally? If this was the business school, it wouldn't be such a question. You know, you'd look around and you would see Boeing and I guess BMW up in Greenville. You know, people are like, why aren't you doing it in that world? Why aren't you going out? Because we're in a globalized environment. You know, we need economically to be linked up to the global economy. But we're in a globalized health sector too. I mean, health issues are global, and there's enormous benefit to be gained by working at the global level. And if I could just specify a few of them to you, one of them is funding. I think you know, we're missing out historically here. We've been missing out on a lot of opportunities to fund important research projects. And I think there's capacity here to tap into funding. So this is a benefit to the school to be able to access available funding. I think secondly, there are things you can study and do in overseas settings that you can't do here. Many health issues, the prevalence or the incidence of them occurring is on an order of magnitude greater in some countries than compared to here. That allows you to run a study and do a trial and much more quickly and effectively determine if things work or don't work. And that's been the case in HIV prevention where I work, where many of the breakthroughs around, for example, the issue of does treatment affect transmission? You couldn't do that domestically very easy. It would require many, many thousands of people because it's a much rarer event, a transmission occurring. Whereas if you go to a developing country setting with high incidence, you can run a trial to identify these things. So a lot of the learning that's really led to concrete benefits back home relate to that. And I think a third area I'd emphasize is that there's, you know, in modern education, there's a perception and a belief and a desire and demand among students to have a broader training and experience. The students want it. They really want to have a chance to work in a developing country context. I don't think we should always let just those issues of why is it good for us mandate these things. You know, we're an academic institution, and our role is really to further science, and science doesn't just happen, you know, within the state borders. Science is something that is global. And you know, in its own right, it's a good humanitarian thing to do as well. One thing I would like people to know, and I, by the way, think a lot of people do know this, in the field know this, but that the work of the centers really had, you know, an impact on policy. The work of the Family Services Research Center has had a real impact on policy. The trials that have been run here have really shown efficacy in how you can, you know, effectively deal with very difficult problems with adolescents around substance abuse and delinquency and mental health problems. So that's the one thing I think I'd want people to know is how efficacious these interventions are. A lot of the work that's been done in research here, you know, has been picked up worldwide and implemented in the United States, in multiple states, and then internationally in multiple countries. So it's really amazing to see research translated into practice that way, and that's something I'd like people to know about.